to the Medicare Journey National Webinar. So if you are a licensed insurance agent specializing in Medicare insurance planning, this is for you. So if you're looking for a way to, number one, get potentially more prospects to get in front of, number two, establish credibility, putting yourself and elevating yourself above any other Medicare insurance agent out there in the country, the way to do that is to have credibility, establish credibility with MedicareJourney.org. So thank you for joining us this morning. This is being recorded, so if you need to leave or you don't catch the entire or you want to watch it again in the future, you'll have that opportunity to review the presentation. So I am the founder. We'll kind of talk about why my vision for Medicare Journey here in just a moment. Introducing you to Erica Bigelow, who is our program coordinator for the team. And Iggy is in charge of our IT, marketing, and social media for Medicare Journey. So here's the QR code. So if you'd like to take a moment and scan that quickly, we'll take you directly to the Medicare Journey website landing page. We are continually looking for agents who have at least 2 years of experience in the Medicare field. We're going to go over what the requirements are. Not anybody can just become a member of Medicare Journey. There are prerequisites, and we'll get to that here during this short presentation. But again, if you can go to MedicareJourney.org, learn more about Medicare Journey and utilize the power of Medicare Journey. And we'll talk a little bit about some of the webinars that will soon be coming out here within the next week or so. In time for 2026 for AEP and OEP, we have utilized many experienced individuals who are going to be our professors of Medicare University. So we got webinars coming up shortly. Excuse me, not webinars, but we do have presentations, videos that you can send to your clients, utilize on your website, and so forth. So stay tuned for that. So I think most of us remembered what the heck happened in 2020 with the C word, dirty little C word happened in 2020 with the coronavirus, right? So what happened after that was a proliferation of these TV commercials. Again, I mean, it is misleading. It has caused a lot of consternation and frustration and confusion with clients, right? With the Medicare beneficiaries out in the field. So it is our job to dispel and bring clarity over confusion. And by becoming a member of a national nonprofit dedicated to education, transparency, and Medicare insurance planning, this is the way to do it. Utilizing the power and the force of Medicare Journey, establishing credibility for you. So you could go, again, going to the website, check out the agent directory. These are certain videos that we're talking about, whether you're turning 65, you're on disability, miscellaneous Medicare resources available, and then also your agent login. So if you are interested in becoming an agent or a member of Medicare Journey, you'll see what the qualifications are, the prerequisites, and just clicking on the agent login will get you to that screen. Our toll-free number is 833-267-6700. You can reach us at info@MedicareJourney.org, and typically Erica or myself will respond to those emails and those requests. So one of the things we've done is utilizing our top 10 critical and costly Medicare mistakes to avoid. So that is powerful to be able to go in and talk about the top 10 issues that consumers are having today. So you will have access to this. You can obviously direct your clients, your prospective clients, to your landing page and send them out these videos as well. So utilizing the resources and these videos and training is going to be important. Also, Iggy does send out on LinkedIn and on Facebook and social media these videos broken down individually, so they're out there as well. And these are the top 10 critical and costly Medicare mistakes to avoid. So not knowing when or how to apply for Medicare, not knowing how much you will pay for original Medicare, choosing to only enroll in Medicare without a supplement or Part C. I mean, it's amazing that we see approximately 11% of Medicare beneficiaries today have only Medicare A and B, only original Medicare without nothing attached to it. So there are clients out there that need that help. And number 4, deciding to not enroll in Part D because obviously we know there's a lot of consumers out there today that do not take prescription drugs, thankfully. And good for them, and God bless those individuals. But by deciding not to enroll in Part D, what are the ramifications of that? Number 5, not knowing the difference between all the different acronyms that this business has, this industry has. Number 6, not knowing if you should stay on your group plan or enroll in a Medicare plan. We talk about that. Not knowing how to choose a suitable or cost-effective Medicare plan. That's very important today, especially what's happening with over nearly 1.5 million to 3 million, and we're still waiting on what the final number is, but we know that there are 2 carriers alone who are terminating at least 1.2 million Medicare beneficiaries from the Medicare Advantage plans. And if you choose a Medicare supplement plan, based on premium alone, what pitfalls that you can see by doing that. So we will educate our consumers, our prospective clients across the country about how to choose the right plan. Number 8, not taking advantage of our upcoming AEP, or the annual enrollment period, election period, or the open enrollment period from October 15th through December 7th. Number 9, and misunderstanding the difference between an MA plan versus a Medicare supplement plan. Trust me, I think we all know, we've all seen it, we've all experienced it, that when you ask a prospective client, what do you have? Oh, I'm on a supplement. Well, how much are you paying for that? I'm not paying a premium. Well, guess what? You're not on a supplement. You're on a Medicare Advantage plan. And then number 10, not choosing the right independent insurance agency or agent to be what? Your unbiased guide. Because as an independent agent, not as a captive agent, because we know captives can't be unbiased typically because they can only sell or represent those plans that they're contracted with, or that one specific carrier that they're appointed contracted with. So as independent insurance agents and professionals, we can sit and educate them about the choices they have. Once we complete our needs analysis with the consumer, what is going to be the best plan for you? And by offering Medicare supplement plans and Advantage plans and Part D plans, that makes you unbiased because you're representing all 3 facets of the industry. You're representing multiple carriers, and that is important, not just 1 or 2. So how do you, as an independent agent, qualify for an agent directory listing? So number 1, again, as I mentioned previously, you got to have at least 2 years experience minimum in the Medicare space, right? So that's number 1. Number 2, you cannot be a captive agent. Sorry. So if you're a captive agent, you might want to consider being uncaptive and going to the independent side. That's important because as an independent agent, we just discussed, it's important to be able to represent most of the other carriers, not just 1 or 2 as a captive agent. Number 3, be able to offer Medicare supplements, Medicare Advantage plans, and prescription drug plans, as we had alluded to earlier. Obviously, this is a big one. I don't think it needs to be said, but unfortunately, it has to be because we know there are nefarious and bad actors in this industry as well. We do not want those people part of our organization. So obviously, it's important to be ethical, honest, professional, and always be educating. Educate your consumers. Be a resource, an ethical resource. Recommend the most suitable plan for clients, even if you're not appointed with that carrier, or you don't get paid commission by that carrier. The most suitable plan is important, right? You may be vetted to ensure you meet the minimum standards of Medicare knowledge. So again, if you have 2 years of experience and you have really not been in the industry, but you've been appointed with certain Medicare carriers for that period of time, and you don't know the difference between an MA plan versus an MAPD plan, or an MA plan versus a supplement plan, how a Medicare supplement plan works versus a Medicare Advantage plan works, and so forth. Obviously, you're not going to be a good fit for MedicareJourney.org because we're looking for competent, confident, ethical, and reputable agents to become members of this esteemed organization. And once your site goes live, There are no refunds. I just want to make sure that everyone understands that. It takes time, energy, and effort to put this together. So 6 months down the road, 2 months down the road, 1 week down the road, you're like, oh, you know what? I don't think this is for me. I just want to make sure that everyone knows, and they do sign an attestation that they understand and submit to all of these requirements. All right. So here are the 3 different types of memberships. Obviously, the free memberships get you a basic listing with your name, your profile picture, the state that you're interested in, your location. The basic membership for $30 a month or $288 a year. That is a significant savings when you pay annually, of course. And think about it. Our commissions are increasing about 9% for Medicare Advantage plans. So if you sell a Medicare Advantage plan, you're making a little over $350 or right around that. So you will more than pay for your 1-year membership at the basic level. And look at all the benefits you get at the basic level. And again, folks, you may want to review this again. It is being recorded, so you'll have the opportunity to go back and we'll send out a copy of the link for this recording, maybe minus the screens not being showed. So I'll have our IT department take that part out. And then the premium plan at $10 more a month at $408 a year gets you everything related to Medicare Journey. So I would say probably one of the bigger things that our agents are getting a lot of value out of. Number one, not only utilizing the trademark logo and the branding and on their websites, putting the logo on their website where the consumer can click on the website, it redirects them to the landing page on Medicare Journey, and also on the Medicare Journey landing page that you have. You'll be able to have your website on that. So it all helps with your SEO or search engine optimization. That's important. Putting it on website, also letting people know that you are a resource, that you're part of Medicare Journey as a member. Consumers can go to the website. You can also utilize the branding, the logo on your email signature at the bottom. We'll show you here on the next slide what you can put on your email signature. And then some of our agents are having excellent experience and success with the nonprofit for utilizing the Medicare Educational Dinner Workshop. So there's vendors that we have relationships with, that when they know, they get an email confirming from our office that you are a bona fide legitimate member of Medicare Journey. You will have a discount on the mailings that go out and also on the bulk mailing permit. So huge savings. I mean, that alone will more than pay for your $408 a year membership, just the savings alone from 1 or 2 mailings. So anyway, take a look at it. It's important that you consider utilizing Medicare Journey, especially during this Medicare AEP season, when we have so much flux going on in the Medicare space and so many seniors being terminated from their Medicare Advantage plans. They need someone competent to turn to. All right, and then also, if you're an Owen Insurance Group or a NABIP agent, you will qualify for a 10% discount. If you are, you can reach out to Erica Bigelow directly at 772-775-4933. All right, and here, if you want a copy of the page, just send an email to info@medicarejourney.org, and we'll be happy to send that to you. And so this is one of our vendors, Lead Jig or Acquire Direct. So basically, we will send an email to that vendor. That the email confirms that the licensed insurance agent, whoever that person is current active member of MedicareJourney.org and in good standing, with their membership expiring on that date. So if you're putting together a Medicare educational workshop and using that vendor for your mailings, and after September 13th, 2024 or 2025 or 2026, whatever that date would be, if you decide that you want to do another mailer, they will check with us to make sure that you renewed your membership. If not, your discounts go away. Just understand that, right? It's common sense. So that is one of the things that we do, that we send out to vendors once you're a member of Medicare Journey. at the premium level. Now, once your membership becomes active, you'll be able to download your own MedicareJourney.org business card to send out and to give to prospective clients, to go to anywhere you want to go to. I mean, I know there was a gentleman out in Texas who, at a college, trying to do Medicare educational workshops at the colleges, and the guy told them that these two agents that they're only looking for nonprofits, and he happened to pull out the Medicare Journey business card. Well, guess what? I am a member of a nonprofit. So they begin doing Medicare workshops at the various colleges there in Texas. Also, libraries. I mean, most libraries, especially here in Florida, will not even consider you to come into the library to do a Medicare presentation unless you're a nonprofit. So becoming a member of MedicareJourney.org will provide you a lot of value. Also, download and utilize the Medicare Journey branding, logo, and images. Offer, use, and download the copyrighted materials at your disposal. Trademark and logo and your email signatures on your website. Link that to the landing page. And this is one of the things that you can do. A lot of our agents do it, utilizing the Medicare Journey logo, and also the disclaimer at the bottom that you're a proud member of MedicareJourney.org, a national nonprofit organization dedicated to education and transparency in Medicare insurance planning. So this is what a copy of the Medicare Journey business card looks like. And also, once you become a member, you can have access to the educational workshop PowerPoint presentation that's been put together. All you got to do is plug and play, put in your logo, put in your name, and so forth, and you will be able to have access to that presentation as well. When you go out to these different venues and you're looking at educating consumers, you'll have access to that. Also, you can join the private community board where agents can communicate with each other in a private forum. We'll talk about the business card template already and the PowerPoint presentation. Also, Facebook. So we put together a Facebook page as well. So we would encourage all of you to go to Facebook, find MedicareJourney.org, and become a follower and like our page. We are sending out information. There is, again, is the QR code if you want to go to the Facebook page directly. We also have a private group, so we've sent out messages to letting our current members know, and I wish more members would sign up. But right now, as of today, we only have 15 members who are part of the Medicare Journey private group page. So we're notifying everybody of updates on the page. So if you are currently a member of Medicare Journey and you're not signed up for the Medicare Journey agent private page, we encourage you to do that. So for those of you that are on the call today, by being on this call, you will have a one-time opportunity in 24 hours to get the discount on your membership, whatever level of membership you want to start out with. Use promo code today20 and you'll have 20% off. So again, if you've got questions, you can reach out to Erica at 772-775-4933 or call the toll-free number 833-267-6700 or send an email at info@MedicareJourney.org. All right, so that is all that we have for the presentation. So we appreciate you being on the call with us today. Again, if you have any questions, you want to get more information, pick up the phone and give us a call. Thank you for being with us today. Take care, everybody.